Hi, so we're going to be talking about the medications that you're taking currently, the side effects and the precautions, and then also the routine that we talked about earlier, developing and integrating into your schedule. So first, I just want to remind you of all the medications you're taking. One of the medications you're taking is flutoxine, and a possible side effect is headache. You may have trouble sleeping. You might feel weakness or a feeling of anxiety or nervousness. If you do feel any of those symptoms, those are side effects of the drugs that you're taking, and you definitely want to be able to contact your doctor and talk to him or her about those side effects that you're experiencing. Another medication that you're taking is chlorpromazine, and a possible side effect is sleepiness, slowness. You might also experience weight gain or dizziness, and the same thing goes. So you definitely want to talk to your healthcare provider about those side effects that you may be feeling, because you don't necessarily want to be feeling those things. And then the last medication that you're taking for your arthritis is the Celecoxib, and that the side effect there is you might have chest pain, you might have stomach pain, diarrhea, dizziness, swelling in your hands and feet, and you could possibly experience heartburn. And if you feel any of those side effects, you want to contact your doctor. And then overall, a huge precaution with all three of these medications is that you do not want to take them with alcohol, and you also don't want to be taking them if you happen to be pregnant or if you're experiencing any issues with your heart or kidneys. So that's kind of the basics of the medications that we talked about earlier in our treatment session. And then now we're going to go over the routine of what we talked about. You had mentioned that you're a nightly reader, so we talked about using your nightly reading as a way to cue you to take your medications and then help you maintain that stable routine. So what we want to go through is just talking about actually having you place all three of your medications at your nightstand next to your book. So when you come and get into bed and you slip into your covers, before you read your book, I want you to be able to see your medications, and then you can take each of your medications. You're only taking one pill, so you'll take one pill of each, and then I want you to keep a bottle of water by your nightstand. And once you've taken each pill out of all of your medication bottles, you can begin to read. And then the easy thing to remember is just on every Monday, you're going to go ahead and replace your water bottle. You'll probably have made it through your entire water bottle at that point, having taken your medications. So just a recap, what you're going to do is make sure your medications are by your nightstand near your book, and then you'll also have a bottle of water, and you'll replace that weekly. And that covers it for our patient education.